Welcome to the Only Healthcare Podcast. My name is Michael Navin, joined by Randy Vogenberg, and we're pleased again to have Deborah Williams join us, who's a tremendous asset and knowledge, has a tremendous amount of knowledge on healthcare policy and legislative decision making. So we're happy to have Deborah back and excited to tackle some serious issues, especially coming off a government shutdown because of healthcare. So thanks for joining us, and I'll turn it over to Randy.
Thanks, Michael. So I think we'll start off with having Deborah reintroduce herself to our audience and say a few words, then we'll get right into it.
Okay. Hi, everybody. I'm Deborah Williams, and I spent my career as a policy person and sometimes a lobbyist in Washington, D.C., working for the congressional committees, the Ways and Means Committee for 6 years, the MedPAC, its predecessor, and then for 3 of the largest pharmaceutical companies. And don't forget my stop along the way with the American Hospital Association. So I had a long history in Washington, and I've seen ideas come and go, and now we're sort of in one of those periods where all the old ideas are floating to the top. And we won't use a metaphor for that. But go ahead, Randy.
Yeah, well, we're certainly a little bit of a deja vu in 2025, and maybe that's where we start, is talk about what the market landscape is like, what we experienced, where we think we're going to end up in 2025 in the healthcare space. What are some of your thoughts?
I think this was a terrible year for employers and others. Healthcare costs are out of control for employers. Although a lot of people talk about the exchanges, the health inflation is twice as high for employers as it is in the exchanges. Prices in the exchanges were now involved in a huge debate on the subsidies for people in the exchanges, which are self-employed and small business. Those are the people who are the bedrock of America, who are bringing us innovation and new ideas. At the same time, if you look at the insurers, are taking the blame for it, but they're looking at costs, for example, for prescription drugs for the first 3 quarters of 2025 are larger than they were in the whole year of 2024. So I don't see anything positive that happened this year.
Well, we've certainly seen a lot of dramatic shifts and catch up still from the pandemic experience. And the way in which the market is reacting, I think to your point, we're seeing double-digit increases in premiums. We're seeing larger adjustments in terms of the benefit designs, such as the deductibles have gone up, and that's been across the board in the private sector as well as in the public sector programs. So what are some of the call-outs in terms of significant events from 2025? You touched on a couple results, but what were some of the key triggers, and then where's that going to land by the end of this year?
Well, I think some of the key triggers for 2025 were methods to sort of press down on public and costs, and those will have spillover costs to employers and others in the market. Some of it may turn out to be positive, and some of it may turn out to be negative. But certainly, let's take, for example, hospital costs, the single largest segment of costs in the premium. When Medicaid pays less, then other people pay more because the hospital market is largely consolidated, and Congress and the chattering classes have completely failed to deal with this issue, which is a problem. The second problem was prescription drug costs, and I'll let you open that issue because that's been sort of the most interesting, compelling story of this year.
So one of the other issues that we talked about, some of the cost shifting that was going on. We now have different consumer solutions that have been put out there in terms of various manufacturers with a direct opportunity for consumers to purchase. Is that going to have any traction as we go into 2026?
Well, we don't know how it's going to break. if it's just in the direct to a patient, there have been study after study after study that shows if costs are significant at all, consumers will just walk away. So the question is it going to be as it first appears? And I think that there's two ways it could turn out. One of which is that one of the ways employers have been walking away, and this gets into the deep detail from drug costs, is to just simply carve them out and use, this is America. We can find a company that will do anything for you. They're called alternative benefit contractors. So you could see a situation where they would carve out some high-cost drugs, and then they would turn to, or are carving out high-cost drugs, and now the drugs are being purchased from Canada or Turkey or Mexico or Bermuda, but they could go to DTCs, which is, frankly, direct-to-consumer, frankly, a little safer, but still leaves the consumer in the same place, which is having to incur high out-of-pocket costs like no one else in the EU or the Western world experiences. I think the second thing is the way it might break is Dr. Oz has made it very clear that he would like the DTC, direct-to-consumer, price to be portable. And Cigna's said that too, just recently. They want the direct-to-consumer price to port over to count towards the deductible in insurance. But if you do that, there are various reasons that just means that direct-to-consumer prices will be higher. Because the only reason they're lower than the market price is they don't affect the crazy government drug pricing metrics. So once you break that, you just break it. So I think that trying to do market-based stuff on top of our current system is, let's just say, I won't say it doesn't work, we'll just say it's very difficult.
Yeah, that's been covered lately quite a bit, not only on social media, but also some of the articles in the press have been talking about this issue of what's the formula for drug pricing and the way in which the metrics are created and reported upon, or kind of a crazy patchwork at this point. So it makes it very difficult. And as you said, it's going to affect the consumer, probably in a more negative way. And it's also going to affect adherence. So patients that have been getting a product, maybe buying it through insurance, now they're looking to get it by cash. At some point, they're going to say, well, either I'm going to abandon it, I'm not going to take it, or I'm going to try and stretch it out over time. I'll take fewer pills or capsules or whatever I'm taking for medication than I've taken before, all of which is not good. So you're right. I think we're gonna see more of that potentially happening, and we also have the opportunity, perhaps with HSAs, MSAs, and so forth. How do we bring that back into play? Because that kind of fell out of favor. Even HRAs potentially could come into play on the retirement side. So I just wanted to transition. Are there other thoughts as we're wrapping up 2025? We're going to be moving into 2026. Are some of these things going to get resolved? Are we going to see it get better? Or are we still going to continue this kind of back and forth in 26, particularly the early part of 26, till we get some consensus in Congress as well as with the administration?
Well, we don't have consensus in Congress, and I don't see that happening. We do have a very interesting wedge movement with the moderates saying, who are going to lose their districts, saying, you've got to do something about the subsidies on the exchanges. And that's a big issue because we were just talking with our videographer about what happened to his costs. And I think that's, the politicians only care not because they care about you, but because they care about the polling, for goodness sakes. And so we had Trump's pollsters say earlier this year, you've got to do something about the exchanges, and now they've sort of doubled back because it's a difficult issue with Congress, who hates the Obamacare exchanges, to say, well, we're going to focus on drug pricing. But the problem is, if you're not taking drugs, that's theoretical for you. If you're insured, you're paying a premium every month. That's not theoretical for you. So I fully expect one of the bodies after next year to flip because of the inability to deal in a concrete way with healthcare costs, because we talk a lot about how we pay for them, but we don't talk a lot about how to lower them in a significant way that the consumer finds affordable. And it's that answer, how do you drive affordability, that people really want to know, and it's really going missing in this dialogue, which is very sad, Randy.
Yeah. Yeah, there's a lot of cracks people are going to be falling into if they haven't already fallen in 2025 as we look at 2026. What are some of the other issues that you kind of see coming down the road, particularly on the commercial side of the ledger, not just the employers, but also with health plans, with potential legislation?
Well, health plans have been effectively demonized, and I'll have to tell you a funny story. I hate personal stories, but this one just happened to me yesterday. My husband called up looking for his appointment for his cardiac version, and the people in the office said, well, we're waiting to get approval from the insurance plan. Oh my goodness, he's on Medicare fee-for-service. He has no approval process. I said to Bob, my husband, I said, give me the phone. He goes, no, I'm not going to let you talk to those people. So, but everyone believes it. If there's a problem, it's not the office. If the costs are too high, it's not the office, the insurer. So when you have such a high emotional, output from people, so much so that fairly decent people were writing that they were glad the person from United was murdered, you don't really have what I would call a rational and productive dialogue, do you?
Mm-hmm. Right. No, that's a problem. Yep. Human nature is very fickle when we start looking at these things. And unfortunately, that's the area that we've gotten into. We're affecting a lot of people at an individual level and at all different age groups. Across all the generations are being affected by this conversation that's going on right now.
Mm-hmm. And, it's ironic to me because, when you work for global companies, you see the global perspective. And, I think Albert Bourla, the head of Pfizer, said it well. He said, about MFN. He goes, I don't mind it. He didn't say I don't mind MFN. He recognized the issue about the fact the U.S. pays more than any other country, but said in other countries, people pay less and they use more product. That's our trade-off. So what I'm afraid here, we'll get most favored nation, but we won't get the greater affordability. And frankly, it's very gameable, which I don't know if we need to go down that rabbit hole, but I think that particularly companies could price for new drugs in such a way that it makes up for losses of any of the European countries. So, therefore, we're not any better off than where we were. If we're not going to do the European model of an assessment, as much as I hate to say it, maybe the liberals and the Harvard portal people, maybe they have a point. If we want to really go down that road of drug price controls, then maybe we ought to really control drugs.
Mm-hmm. That'd be an interesting proposition to see if it gets legs or not.
Yeah. Without campaign finance reform, it's unlikely, just as much as it is our inability to deal with hospital costs is unlikely, and our inability to deal with, you name it, Randy. I mean, 2025, if you had any optimism, 2025 should have just thrown in the trash can. So 2026, what might they move on? Are they really going to move on PBM reform? And I know, Michael, you and I have, I know we have kind of different opinions on PBM reform. I see PBM reform when you have very high drug costs as being counterproductive, because they're the only intermediaries who can set up the formulas and negotiate the rebates. So what are you going to do? Um, it's very counterintuitive. What do you think?
Well, then you also have the issue Rand Paul is now talking about, basically association or affiliated health plan option. Try and put in some legislation around that, which probably is not going to happen this year, but it may have some discussion using the example of Costco. Is what's been talked about. So you could join Costco and join their association health plan program and let several 100,000 people who are a member of Costco negotiate with health plans to get better prices, including the drugs. So it does change the leverage proposition potentially. But again, to your point, you're trying to move a whole system and you're not doing it in a comprehensive way. You're still doing it piecemeal, and as long as you keep doing it piecemeal, it decreases the likelihood that the change is really going to happen or it will stick. And that's kind of what I've been seeing. Is it's so not only so convoluted, it's also very difficult because all the different pieces are moving at different rates and speeds, or not moving at all. No change. And that's been part of the problem on the commercial side. So as a result, all we've had is rates going up every year for the last 3 years at double digit. And there's nothing that anybody can really do about it. And these are fairly large self-insured employers and groups of self-insured employers, and they still have the same problem.
Right. Well, if you only have one hospital system to deal with in your market, then you don't have any market power. I mean, if you're sitting in Pitt, what options do you have except to fly your, employees elsewhere for a knee replacement or something else? It's impossible for employers to solve the problem if we won't deal with the underlying cost structure. And the worst thing is these ideas that are being dragged up are ones that sort of have failed before. Cooperative plans failed. They couldn't really afford it. They were too marginal. They couldn't, you really have to have risk-based capital. That's why we have insurance regulation, because so many plans sold policies and then went belly up. You have to have, some kind of reserves. You have to have nose and tails insurance and reinsurance and stop loss. It's a complicated kind of business, isn't it?
Yeah. And we're not even into the new generation of products as yet, particularly the gene therapy. We haven't seen the big bust out of what happened with cell therapies coming into the market as yet. Its potential could be as bad as the gene therapy in terms of driving costs up dramatically in a very short period of time, which doesn't allow for that risk adjustment that you're talking about in the marketplace. So we still have more shoes to drop, so to speak, that we're going to be facing as we go into 26, 27 in particular. And when you expand that horizon out to 2030, we have no solutions right now for where we see the market changing. And that's not even including on the medical side, as you pointed out, with hospitals. You layer in the rural health scenario as well, which is a big problem in many states, where if you're in a rural area, you may not even have a hospital right now, and you barely have medical care. So there's a lot on the table that has to be looked at as we move into the year 2026. And that's going to be key, particularly in the first half of the year, because that's when all the decisions are being made for 2027. So the windows are already beginning to be prepared to be shut on 2027, and we haven't even got into 26 yet.
Yeah, so my hypothesis is that all these things will be tried and they will rapidly be unpopular with consumers, as high deductible plans are. They'll kill people. There's research that shows that people who had high deductible plans and get cancer, even if they knew that they had a predisposition to cancer, have higher mortality rates. So we used to say at Ways and Means, that my boss would say, who wants it? And the question is, what consumer is raising their hand for higher costs, HSAs, et cetera, et cetera, et cetera? The answer is no one. So all these will fail, and then we'll get some Euro system, which, because we won't deal with any of the underlying costs, will be twice as high as it is now. So,
Well, let's end on maybe a more optimistic note. What
Thank
do
you.
you see on a positive light as we go into 2026?
A positive light. Well, traditionally Republicans have been loath and have hated discussing healthcare. That's part of the problem. And so I think that someday they have to go home and they have to have town halls. So maybe they'll come close to figuring out some kind of relative solution, perhaps. And I think the primary impetus, if the liberals can get past getting exactly what they want, it's just, it's everybody getting past exactly what they want. Maybe we can come up with another solution or another patch to our system. But again, without campaign finance reform, solutions seem sort of hard to find.
Yeah, you bring up some excellent points of view from the experience that you have from the DC landscape. It's going to be an interesting 2026 for sure, no matter what. There's going to be some ups and downs. It's going to be a roller coaster ride. We're going to definitely see change. We know that. Whether it's going to be good or bad remains to be seen, or how bad it might get. But hopefully, on an optimistic note, the populism that you're talking about, the consumerism, I definitely don't see that going away. It's only going to get stronger, to your point. It's going to affect the elections. And when you start affecting elections, that's when you really start to see, at least from the legislative side, some change. We're already seeing some change on the employer side in terms of who's looking for what in benefits. Benefits are still a strong driver as to where you want to work and who you like to work for, if you're going to stay with an employer, and so on and so forth. So there are some constants that still are in play, but for the most part, we're still kind of in this neutral zone, as we've been talking about. Not a lot's happened in 2025, and 2026 is still a big question mark as to what we're going to end up seeing.
If the economy still stays in good shape, I would assume the employers will still find it affordable to provide health care costs.
Oh, yeah. All the indications are the economy is going to be very strong by the second quarter. Employment is going to go up. It's going to look differently than it did in 25, mainly because of what we're seeing in the AI innovations, not so much AI itself, the computer side, but really in the applications that come off of AI. So there'll be plenty of jobs. There'll be different kinds of jobs. And how that trickles down is part of the question that we're kind of talking around. And then ultimately, what does it mean? Where people are moving. We've had a lot of people on the move since the pandemic, also because of the high costs in some of the northern states and western states to the southern states. So there's a lot of activity in the southern states right now in terms of job creation and businesses moving in to those areas. That's not likely to change in 2026, even maybe 2027, the way the investment cycle looks right now. But needless to say, it's interesting. We could probably talk about this all day long, but we're going to have to call it for today on this episode of the Only Healthcare Podcast. And I appreciate Deborah joining Michael, David, and myself again to kind of give us some lines of thought and some different ways of thinking about what's happening in Washington. What are some of the key questions to ask? Like, who's going to vote for this? Who's going to say yes? And please stay tuned to the Only Healthcare Podcast. Subscribe, go to our website, and we look forward to seeing you in the future Only Healthcare Podcasts.
One last point, though. I'd keep a close eye on the president, and when he breaks for health care, because he figures that it will, in some way, it'll affect him other than is now, and he lets what they're doing now fail, then we'll see things break another way, because he is a populist, not a conservative. So that will tell us where everyone is going to go.
So we saved the best for last. Great
There you
comment.
go.
Thank you, Deborah.
Thank Thank you for tuning in to the Only Healthcare podcast. We hope you found today's episode insightful and informative. Remember, our mission is to provide actionable and inspirational insights on how we can improve healthcare cost, care, and accessibility for all. If you enjoyed this episode, please subscribe, rate, and share with your friends and family. For more resources and updates, visit us at onlyhealthcarepodcast.com. We'd love to hear from you. Let us know what topics you'd like us to discuss in future episodes. Until next time, stay informed, and together, let's navigate the journey to better healthcare.